Good morning, everyone. Thank you, everyone, for joining us this morning. I'd like to welcome Congressman Gottheimer, Congressman Pascrell, my dear friend Senator Menendez, and State Senator Loretta Weinberg to this event. This bill is long overdue, and this issue needed to be addressed a long time ago. I think that according to the statistics, we're going to have a shortfall by 2030 of 120,000 physicians. And I'm glad to see that our senators and our federal legislators are doing the work that needs to be done so that Teaneck can remain strong and Holy Name can be one of the premier hospitals in Bergen County. With that, I would like to introduce one of the premier CEOs in Bergen County, who will be introducing and taking over the program, the CEO of Holy Name Hospital, Mike Marin.
Thank you, Mayor Hamilton. Good morning, everybody. Welcome. This is a milestone day, very important issue that we're here to address. I want to thank Senator Menendez for taking time out of his busy schedule. Representatives, Congressman Bill Pascrell and Josh Gottheimer, Senator Loretta Weinberg from the state, all here to address something that we know is a critical issue. You're going to hear a number of speakers today, but let me tell you something just a little bit different about Holy Name. So Holy Name has been in teaching in the past. We have a nursing school that's been in existence since 1925, one of the largest in the state of New Jersey. We used to have a partnership with St. Michael's in Newark, where residents would rotate through Holy Name. And at St. Michael's request back in the 90s, that program came to an end. And we are plagued by a problem that in 1996, as that program was winding down, we reported 5 FTEs on our Medicare cost report. And so the rules say today that if Holy Name were to get back into teaching, which we do in a big way, and I'll explain why, we would be capped at 5 FTEs and for what those residents cost in 1996 based on an escalation from that period of time. It's woefully inadequate. If Holy Name had reported 0 in 1996, and this is the unfairness of this regulation, we would be free to start the largest program we could possibly take here today without any encumbrance, without any hindrance. And so to me, it makes no sense when we know, and is well documented across the country, but especially in New Jersey, we're on the verge of a severe physician crisis. We're on the verge of challenging how physicians are educated. And we want diversity in that exposure, and our colleagues and our friends from Sinai are going to talk about this as training physicians come through. So Senator Weinberg and I both sit on a board related to medical education. We've been infused with a whole host of information over the last couple of years related to this. Both having the 3rd and 4th year clinical rotations as students are in medical school is important, but that is only good and viable when you have a postgraduate medical education program for those PGY 1, 2s, and 3s to come through. You need to have both in tandem, common faculty, common placement. One of the other problems that faces New Jersey is the majority of the residents that train here choose not to stay here. They leave New Jersey, and we need to get them to stay. And the part of that is having them exposed to new and different programs. It is often said that the good physician treats the disease, the great physician treats the person who has the disease. That is, humanism in medicine is a big part of Holy Name's culture. It is a big part why we are able to thrive as an independent hospital in a system that is faced with major consolidation from stem to stern. That component in teaching new physicians how to perform, how to engage their patients, we think is critical going forward. So again, I want to thank Senator Menendez, Representative Pascrell and Gottheimer for taking this initiative. It couldn't be any more timely. It is essential for the future of healthcare in New Jersey that we start to move forward and that we be unencumbered in our ability to do so. So thank you all for being here. I want to introduce now a very good friend, Senator Loretta Weinberg. Senator Weinberg.
Thank you very much, Mike, and welcome everybody to Holy Name Hospital, which I used to describe as my friendly neighborhood hospital. When my two kids were in school here, and they were both jocks, we visited the ER here on a number of occasions where they knew their Blue Cross Blue Shield number by heart in those years. So this is a great institution for the Township of Teaneck and indeed for the County of Bergen. And to be able to enlarge our teaching facility is of the utmost importance. And it is my honor not only to stand up here and speak on behalf of the medical institution, the wonderful medical institution that Holy Name is, but to welcome to the rostrum 3 federal representatives. First of all, Teaneck is privileged to have 2 Congress representatives. As many of you know, Teaneck is kind of divided between Congressman Pascrell and Congressman Gottheimer, but none of us keep track of what those dividing lines are. The almost 40,000 residents of Teaneck consider that we have 2 congressmen. And certainly our U.S. Senator, Bob Menendez. I am privileged, Senator Menendez, to have you here in Teaneck, along with our mayor and the other members of the medical staff who are here, and to have you stand up on our behalf for the Teaching Institute, that this should be, as well as a big step forward to solve the medical shortage that is impending right here in New Jersey. And hopefully a lot of it will produce family care physicians, which we know we need the most. So with that, I would like to ask Senator Menendez and our 2 Congress representatives, Gottheimer and Pascrell, to come forward. Congressman Pascrell, in honor of whoever it was you kicked, we have a chair up here for you to be able to sit. Thank you. Senator Menendez.
Well, good morning. And the person who engaged Congressman Pascrell is not at a quality hospital like Holy Name. So let me thank Senator Weinberg for her gracious introduction. I'm thrilled to be here with my colleagues. It's rare to get the whole federal delegation together that represents a community at one time, but this is an important issue, not just for Holy Name, but for the community at large. And we're thrilled to be here with members of the legislative delegation, as well as with Mayor Mnuchin, who does an exceptional job here, and with some incredibly talented members of the hospital's medical profession and administrators who will speak to you shortly. And you have an incredible CEO. I get to deal with all of the CEOs of this state, both in the hospital context and in the corporate part of our state. But you have someone who is a visionary and who matches that vision with a tenacity that belies his mild-mannered approach. And he is just one exceptional person. My mother, when she was alive, would say to me, if you can say something nice, say it, and if not, keep quiet. So Mike, I can say something a hell of a lot nice about you. So Mike Marin, you are an exceptional CEO, not just for Holy Name, but for our state. So. We're here to announce a new legislative effort to help Holy Name recruit and train a new generation of doctors, and thereby secure its future as the go-to place for healthcare, not just in Teaneck, but in the entire region for decades to come. This is truly a very different place because of its mission and the way it carries out that mission. By all accounts, New Jersey is a great place to practice medicine. We have some of the finest hospitals, universities, and medical innovators in America. We have a population of more than 9 million people, including nearly 1 million New Jerseyans with health care coverage today who were previously uninsured, thanks to the Affordable Care Act. We have pharmaceutical and medical device companies spearheading new treatments and cures. We have well-respected medical schools and innovative research underway at our colleges and universities. With patients from across the nation and the world seeking care in New Jersey hospitals, our state should be a top destination for medical school graduates to launch their careers. And yet, as you heard from Mike and you'll hear shortly from Dr. Poole, we face a growing shortage of physicians in our state. Nationwide, an estimated 40% of physicians will retire within the next 10 years. And New Jersey has the third highest percentage of doctors over the age of 60. Not that that looks too bad to me these days, but in any event, still a challenge moving forward. New Jersey also has fewer medical students and residents compared to similar states, even with newly opened medical schools at Seton Hall and Rowan. We face steep competition from the Philadelphia and New York job markets, and we need more funding for training programs to meet the demand for new residents. Put on top of all of these headwinds, outdated federal laws have made it even tougher for New Jersey hospitals to bring on more medical residents. As you heard from Mike, take Holy Name, for example. They're ready to take a residency program on and help fill this gap. And I commend Holy Name for working to invest in the physicians of the future. But under current law, if they restart their residency program, they'll be subject to the same Medicare hiring caps imposed all the way back in 1996. It makes no sense. 1996 is not 2019. These caps have failed to keep pace with the growing demand for a larger physician workforce. And beyond the wave of physician retirements, we're also in the midst of a silver tsunami of patients who will need more care in the years to come. That's why today I will introduce in the Senate, as my colleagues have introduced in the House, the Supporting Graduate Medical Education at Community Hospitals Act in the Senate, along with, as I said, Congressman Gottheimer and Pascrell in the House. Our legislation will allow Holy Name to relaunch their residency program without the caps on Medicare-sponsored residents set in the mid-90s. The bill also complements a broader effort in the Senate that I have with the Resident Physician Shortage Reduction Act. That legislation would initiate a nationwide hiring surge of medical residents in America hospitals by increasing the number of residency slots by 3,000 a year for 5 years. We cannot let outdated Medicare caps from the 20th century keep us from recruiting, training, and hiring the physicians of the 21st century. My legislation also includes new residency slots in community hospitals, rural and underserved areas, and specifically in states with newly launched medical schools like New Jersey. So let me close. Residencies are a formative time in the education of every doctor in America. It's time for medical graduates to apply the lessons of the classroom, explore specialties, and gain real experience in patient care. And for many doctors, it's also the time to lay down roots and decide where they want to start their families and build their careers and their lives. We want America's best and brightest medical school graduates to lay down those roots here in New Jersey. And so that is a good part of what the legislation is about. We cannot have a great healthcare system without great doctors. And when we have this aging out of our doctors, and we have a slow process to get doctors into the pipeline, and when we have a situation that the law prohibits and basically punishes institutions like Holy Name who want to meet that challenge, we need to end that law and change it and build it for the 21st century. With that, let me introduce my colleague in the House who has been leading on this issue with Congressman Pascrell, Congressman Gottheimer.
Thank you very much.
Thanks, Bill. You get to go first, actually. You're definitely more senior. I'm deferring to my senior colleague here if he wants to.
He loves to say the word senior. Thank you, Josh. Thank you, Senator. Your record since you've been in the House and the United States Senate speaks for itself, and always being there on health issues. And I think you ought to take a look at our records. We're proud of them because the most personal thing that we deal with our people is people's health. And we've been through battles on the ACA. We've been in battles on how to do it. And I'd rather stand next and work with Bob Menendez than anybody else in the Senate. I'll tell you that. You always know where he stands. So, Josh, last year in the House of Representatives introduced 6056. That was a very important piece of legislation. We talked about this at length. Advancing medical residence training in Community Hospitals Act. And I was proud that he asked me to be an original co-sponsor. We'll be introducing an updated version today when we go back, and we got to catch a train in a little while to go back. To really correct the arbitrary and outdated cap that the senator referred to, and makes graduate medical education slots available. You know, I had some sad news, which I just found out about 2 days ago, and that is the medical school, educational institution attached to Drexel University is closing in Philadelphia. That's over 500 people studying to be doctor. So we have come across now this major problem. I mean, we didn't invent it, nor has it just happened. It's been going on for the last 15 years, and it's going to get worse. Our situation with nurses is going to get worse. Our situation with teachers teaching science, technology, engineering, and mathematics is a disaster. And we have to be in the business of providing incentives. I can't think of a better way to spend taxpayers' money, because we're going to need these things. And with the news that China is going to be the leader, they intend to be, in terms of artificial intelligence. So we got to make a choice. Either accept the status quo or move on. If we don't have doctors, like if you live in rural areas, you don't have doctors. Many times you don't have hospitals. So that's either important to you or not important to you. Well, if you don't live in a rural area, why should it be important to you? It should be very important to you. If we care about the health system as such. So I want to thank you for being here today. I had to get a passport to get into Josh's part of the district. My district is across the street.
Literally.
And his offices are in my district.
No, you're right. The offices, Holy Name's offices across the street are your district, and the hospital is my district.
Yes, very good. I wanted to confuse it there for a little bit, though.
We're going to walk across to your district right after,
Okay.
if you'll let me in.
So, you've heard honest accountability about Bob Menendez. And Josh, in a very short period of time, you've made your footing well known and what you think about the nation's health and how you're trying to address it. Not just bumper stickers, but real stuff. And Tom, everything that, Michael, everything that Bob said about you is absolutely true. This hospital is a good hospital, great hospital, and you are a great leader. We need leaders in healthcare and not just provocateurs. We need people who know what they're doing. This is important when you have a slowing down of personnel. I mean, you wish you had that opportunity. If a doctor's thermometer takes our temperature, our national focus on medicine is itself a barometer of a nation. A healthy nation builds its medical fleet, and right now we're not doing that like we should be, even in a progressive state like ours. In fact, we're approaching a crisis. The Association of American Medical Colleges estimates a shortfall of up to 120,000 physicians nationwide. I mean, if that isn't an urgent need, what the heck is? The number itself is startling. By the year of 2030, that's not that far away. Next year, we are expected to need up to 2,800, just next year, in New Jersey, physicians. This need is partially from the growth and what Bob talked about. Folks are getting older, going to retire. They had a lot more sense than I did. But that is not the whole story here for our pending physician shortage. Much of our program can also be traced to outdated laws. And by the way, that bill was passed in 1996 before I got to the Congress. You were here, I was not. Let's make it clear. Don't look so serious. If we want to keep growing as a state and as a nation, we need to bolster our medical pipeline by expanding physician training programs. Our legislation will reverse these outdated policies. Right now, community institutions, and that's what this hospital is all about. Holy Name can only support 6 graduate medical students. That's bizarre. You look at the numbers I just quoted, doesn't make sense. It doesn't make sense. I don't need to tell anyone here that it's not enough. If we become law, this legislation, Holy Name would likely support over 100 graduate students when you figure out the math. So think about the difference that would make up for the families in our community. This change will create new jobs right here in Bergen County. I know that I'll use my seat on the Ways and Means Committee to help get the bill to the House. Senator Menendez will use his seat in Finance to help get the bill through the Senate. We're going to work with Josh. We're going to work our tails off because we know the stakes are high, and we want institutions like Holy Name to be the best they can for our community. And now I want to introduce my friend, Josh Gottheimer. You should listen to our conversations during the day in the Congress of the United States. Some are not repeatable. But we talk about most of the issues and most of the attempts that we do have, but no one works harder than Josh. No one cares more than Josh. I'm honored to work with him. I hope he'll put up with me for a little while longer.
A lot longer.
And I thank him. Josh,
Thank you.
thank you, and you're the sponsor of this terrific legislation, and I'm glad to support it. Thank you. You're welcome.
It's very tough to follow Bill Pascrell. I don't think I can up that. I'm sorry, Senator, but I'll try. I do want to thank, first, before I thank my colleagues, I want to thank the incredible doctors, nurses, administration, and staff here at Holy Name. It is, as the Senator said and as the Congressman said, when you have a real question that you need a serious answer to that's thoughtful about to help our state and to help our families and medical care, you pick up the phone and you call Mike. And I think that you've been an incredible resource to me and to my team, but also what you do here and what your team does here really has made a significant difference for our communities and our families, and we're all very, very grateful for you. So thank you very much for having us. Dr. Poole has been a great resource to many of us as well, and we're looking forward to hearing from you, sir, and appreciate your leadership. And Dr. Jarrett and Kornitzer, thank you also for speaking out on this important issue. Our colleagues here, Senator Weinberg and Assemblyman Johnson and Shapizi, and the mayor, thank you very much for welcoming us into your town. We're very grateful. And I would like to, if I could take just 1 second to praise my 2 colleagues here, if that's okay. Bill, even though you're 5 feet from your district and you're here, you're welcome, as you know, anytime in my district, because I honestly, if I didn't have your mentorship along the way, between you and what Bob have done for me, and always looking out for helping us in our community and me and helping me do my job better, I'm incredibly grateful. And what you do for law enforcement, we're incredibly grateful, and firefighters. This legislation without the 2 of you would never happen. And I get that, between your leadership in the Senate and making this happen, and Bill, you on Ways and Means. And if I could talk just 1 second about Bob with Senator Menendez, who has many leadership perches. One of them that that protects us every day around the world and at home on the Foreign Relations Committee, level-headed, being able to actually bring great reason to many of daily conflicts and protect our great country. And then when you come home, you continue to protect our communities. Your leadership on healthcare is very well known, and protecting us and protecting our families and making sure that we have healthcare and affordable healthcare, I think, deserves an enormous round of applause. So thank you, sir. As you heard today, we're here to address New Jersey's physician shortage and ensure our communities and North Jersey patients and families are able to receive the care they need and deserve. Our graduate medical education bill together will help meet our children and family health care needs by making New Jersey hospitals even more competitive. Here's the problem, as you heard from Mike and you'll hear from others, and as you heard from the two members. Right now, when a student graduates medical school, he or she enters residency at one of our top nation's teaching hospitals. Statistics show that if someone does the residency at a particular hospital, they are more likely to stay in that community. So they go to medical school, they graduate out, they have to go to residency, right? And then they often stay in the community, right? And are able to treat our families and, of course, help our economy. And training a new doctor isn't cheap. And by the way, it shouldn't be. We want our medical professionals well-trained and ready to take care of our families, not a place to cut corners. And that's where, of course, you have the government come in because of and make sure they can help in that process. Now, because of an arbitrary formula that, as you heard, is more than 2 decades old, that's existed for more than 2 decades, Holy Name has been capped at 6 teaching or GME slots, greatly limiting their ability to draw new doctors and run a competitive program. As Bill just said, if we fix this, you could have 100. So it gives you a sense of just how limited it is. Our legislation together corrects the arbitrary and outdated cap, which will help us recruit and retain more talented physicians to help our New Jersey medical community grow. It will make graduate medical education slots available to hospitals that have been locked out for decades now, and allow hospitals to invest in teaching programs to attract medical students to Jersey and keep our health care workforce competitive. As Bob was saying, we lead the country in life sciences in New Jersey, yet we have policies like this that are greatly holding us back when we should actually be, of course, looking for every which way to lead. We have medical students studying and training here in Jersey, and evidence suggests that doctors will stay here when they train, except for New Jersey. The problem right now, what you heard about, is then if the slots aren't there when they graduate and they don't have a residency to go to, they leave. So we have students right now at Hackensack Meridian School of Medicine, at Seton Hall University, right here in North Jersey, or Rutgers, New Jersey Medical School in Newark, or Robert Wood Johnson Medical School in New Brunswick. They're at Cooper Medical School of Rowan University in Camden. In other words, we're training the best and brightest here in Jersey to practice medicine, and then when they graduate, there's no slots for their medical training. So unfortunately, they then too often leave. And it's happening at Holy Name. There's no place for their residency. There's just not enough slots. And that's the real issue that affects our medical care and our economy. To me, it's just common sense to have more hospitals for our new doctors to train here in Jersey. We need care, the community needs care, our baby boomers are aging, we need to take care of them, and we need doctors who are able to do that. And we especially need them in Jersey. New Jersey ranks 32nd nationally in the number of medical students as a share of total population. 32nd. Currently, because of population trends and an aging population, we will need an additional 2,500 to 2,800 physicians by 2020 to meet New Jersey's healthcare needs. Bill talked about the 100,000 around the country, right? We need nearly 3,000 here in New Jersey. But New Jersey is the 25th most likely state to see a doctor shortage. So we have a problem. We know we need more doctors, right? We know it's coming up, and New Jersey has a real problem being able to fill those slots. This is why we need to get more at Holy Name and other places. According to the data from the Association of American Medical Colleges, New Jersey has among the highest rates, 3rd highest, of practicing physicians over the age of 60, as you said, which of course is young, but the bottom line is, as we look at the trends, right, you're going to need more, and it's going to open up an even bigger hole and bigger need. The legislation we are introducing today will not only help Holy Name raise their graduate medical education residence caps and meet their community needs, but it helps other New Jersey hospitals do the same. Capital Hopewell, Lourdes Burlington, and others across the country, they're all suffering from these low graduate medical education caps based on 1996 formulas. So raising the graduate medical education caps will promote and draw in more. It also helps, of course, increase diversity, which is which is essential in the medical profession as well. And it will really solve a problem that, this is a real problem, and I think what we're trying to propose together will help solve it and address this arbitrary cap and this arbitrary formula that's existed for more than 20 years now. So we're very proud of our world-class schools, our incredible hospitals, our incredible life sciences sector, right from Holy Name to Hackensack to Valley in my district. We have so many excellent hospitals that provide care. We just need to make sure that the doctors are there for the future. And with this bill moving forward, we're introducing it in the House, and with the senator leading it in the Senate, we'll finally be able to address this physician shortage that has left an incredible need. And with that, I think we're going to introduce, is Dr. Poole next? I'm going to introduce John Poole. Dr. Poole, thank you so much.
Good morning. My name's John Poole. I'm a general surgeon at Holy Name. I'm the president of the medical staff of Holy Name, and I'm the immediate past president of the Medical Society of New Jersey. I've had a career-long interest in medical politics. Some of my colleagues call that a pathology, but I think what happens here, things like this, is just as important as what happens to my patients in the operating room as well as in the exam room. So first of all, I'd like to thank, I'm one of those doctors that's over 60. Josh, thank you for calling me young. So a couple things. You heard the statistics. There's going to be a shortage of 120,000 doctors nationwide, maybe close to 3,000 in New Jersey, but it's not just the numbers, it's the kind of doctors. So the AMA has taken on, one of its strategic plans is to reform medical education. So medical school hasn't been reformed since the Flexner Report over 100 years ago. And so right now we train physicians with, when I train, basic science and clinical science, but we need to add system sciences into that, and to make sure physicians understand how to practice in team-based care and how the other providers of the team are going to practice to the top of their license. How physicians are going to deal with disparities in healthcare. We have a healthcare system now where at times your zip code is as important as your genetic code, and how are we going to incorporate that to realize the triple aim of healthcare: better care, better health at a lower cost. And so how we're going to incorporate palliative care in that training. And the AMA recently took on training graduate programs too, residency programs, so that we can reform how medical students and residents are trained and prepared to practice in this new system. If you ask any voter out there, healthcare has been one of the top issues over the past several elections. I'm sure it's going to stay that way for this election. This is a vital part of that conversation. In the late 90s, Congress froze the Medicare funds residency positions. Congress froze that funding. Back in the 90s, we didn't have iPhones. We didn't have robotic surgery. We didn't have hybrid cars. The world's a different place, and I look forward to this bill helping change that. I've been practicing here for 31 years. I was here, as Mike explained, when we had a program with St. Michael's. Some of the most established and respected primary care practices at Holy Name now came through that program and chose to stay at Holy Name, and we've lost that vital pipeline. Plus, I have a personal interest. You talk about I'm over 60, I guess pending retirement at some point, and I look forward to help training the physicians that are going to take care of me when I need it. So thank you very much for proposing this bill. We're in a perfect storm right now. We have, some of this is a good thing, we have more demand as patients with the Affordable Care Act and patients get increased access to health care. We have a retirement crisis with physicians in the future, and so this bill will help address that. New Jersey has some challenges besides that. We've had, and so You know, I first met Loretta Weinberg, she usually mentions this, in 2002 when we had our tort reform crisis, and I was picketing her office outside, and she came downstairs and offered me cookies, and we became dear friends ever since. So,
Girl Scout cookie.
yeah, so thank you for your leadership in this
Thanks,
issue.
Tom.
Thank you.
Thanks.
Thank you.
Thank you, Doctor.
My boss, Dr. Jarrett.
Thank you, Dr. Poole. So in my role as Chief Medical Officer at Holy Name, I spend a significant portion of my time trying to recruit physicians. And we've had some success here at Holy Name, and we're grateful for that, but we've really struggled, particularly in recruitment of primary care physicians, family doctors, internists, and pediatricians. And a large part of that struggle relates to this old law that everyone's been talking about from 1996 that caps our ability to start a residency program. We see a day where this bill passes and becomes a new law, and we envision a day, as people have discussed, where we have over 100 residents here, particularly in the primary care specialties as well as in palliative care. We are looking to train the next generation of physicians and train them in the way that Holy Name likes to take care of its patients, with both the skills and the compassion, as well as taking care of the entire patient and taking care of the patient from birth to death. So we see this bill potentially fixing two issues. Issue number one is the physician shortage, particularly here in northern New Jersey, but throughout the state and throughout the country. But also, particularly a passion of ours in New Jersey is training doctors to take care of the entire patient, particularly as it relates to end-of-life care. So we need to address this healthcare problem, and we need to do it with a robust academic medical program here at Holy Name Medical Center. I wanted to thank the Senator for joining us today. Thank Senator Menendez and Congressman Gottheimer and Pascrell for joining us. We also are going to invite to speak to you today our relatively new partner of Mount Sinai, who has certainly lots of expertise in medical education, and they're going to talk a little bit about our relationship and their view on this bill. And so to talk first is Sean Healy, who is the Chief Operating Officer of the Mount Sinai Health System.
Thank you. It is an honor for Mount Sinai to be here and to be a partner with Holy Name Medical Center. Thank you, Senator Menendez and members of Congress, for your strong advocacy for expanding the GME program and for the health and vibrancy of our hospitals in New Jersey and throughout the country. Dr. Cornitzer and I are pleased to represent the Mount Sinai Health System, Dr. Arthur Klein, and the Mount Sinai leadership to support this important initiative. Mount Sinai is a major center for graduate medical education, and our sponsored consortium trains the largest pool of residents and fellows in the country with over 2,500 trainees annually. And we are honored to work with Mike and Adam and the rest of the team here to support this going forward. We recognize and emphasize the sentiments shared today about the critical shortage of physicians. It's something we think about a lot at Mount Sinai, and through partnerships like this with Holy Name, we want to support the expansion of these training programs. And it's already been said, but the shortages are greatly exacerbated by these types of limits in graduate medical education. And it makes no sense. It makes no sense to the folks in New York. It makes no sense to the folks in New Jersey. Everybody gains by having highly trained physicians. And so it's not a specific issue to New Jersey. The limitations on our graduate medical education system are a real problem because we want to train and ultimately accommodate the care and needs of a growing and aging population. So population is increasing, older population is increasing, and it's unsustainable for us not to support this kind of legislation. So thank you very much for having us here. We're honored to be here. Turn it over briefly to my colleague, Dr. Ben Cornitzer. He's the Chief Medical Officer of the Mount Sinai Health Network. And Ben.
Finally got there. So I actually happen to be a physician under the age of 60, so I plan on having a long and fruitful career ahead of me. So it's absolutely essential to support communities in New Jersey that we have this bill going forward so that in a couple of years when I come back here, it's not filled with members of the press, but it's actually filled with residents and fellows and teaching faculty. At Mount Sinai, we believe there's real value to having training programs at multiple geographies. Healthcare is changing. Increasingly, care is delivered in an ambulatory setting where patients are seen close to the places where they live. Having training programs embedded in the communities has a couple of really important impacts. One is that it sustains and energizes the medical staff. It brings a new approach to healthcare where people are constantly looking at what are the latest teachings, what are the latest medical practices, and have that dialogue that's really critical. It creates lasting relationships between very critical institutions such as Holy Name and their community. It attracts and retains a higher caliber of physicians so that going forward, residents of New Jersey have access to the highest level care that's possible. Mount Sinai, as Sean and others have noted, has a large and long history with GME. We train over 2,500 residents and fellows a year. We understand the resources and investment that are needed to be made for this to be a successful program, and we are 100% committed to working with the excellent leadership here and identifying what those resources are, what those strategies are, so we can be partners in helping to support the further growth of this residency program, which is clearly critical to the health of those in northern New Jersey, but really this is a critical issue for people throughout the entire country. So thank you, and we're very much looking forward to that future state where I look out and I'm going to see residents and fellows here next time I'm at this podium. Thank you very much.
So Senator Menendez and the Congressman are open to questions, if anybody has them.
And the hard ones Mike will answer. Yes.
This is really more for the doctors. Just yesterday, I just looked up on my insurance company, Blue Cross Blue Shield, NJ and I wanted to see are doctors available. And out of 130, the first 138 doctors I looked up, including 20 with the parameter just for this hospital, every one of them, 100%, are accepting new patients. So I'm thinking, what shortage? Every single doctor that I looked up, and I just stopped because after 138, you have to be a statistician. So it made me think, is there a shortage? Why is every doctor accepting new patients? And I'm probably missing something. Please clarify that.
So,
Come to the microphone.
excuse me. So at Holy Name, we have about 1,000 doctors on the medical staff. We have a Holy Name network of physicians that are contracted or employed by the hospital, close to 200. The issue primarily, but not solely, primarily is the breakdown of the types of doctors that we have. So our physician network, which consists of about 200 doctors, is about 80% specialist and 20% primary care, and it should be reversed. So yes, some of what you're saying is correct. You can get into the super subspecialists, but as a primary care doctor, and most doctors will tell you, you don't want to start with the super subspecialist. You want to start with your primary care doctor. And getting into primary care doctors is much more challenging than getting into specialists. I am not saying that we also don't need more specialists because as people have mentioned earlier today, we are going to have a real crisis in the next 5 to 10 years because the specialists are all going to retire. But the immediate need is that primary care program, which is why if this bill passes, we plan on starting a residency program for pediatrics, internal medicine, family practice. And that's where the immediate need is, but there's going to be a major crisis with specialists in 5 to 10 years as well because of the age of physicians.
And it also might be that your Horizon plan has a lot of physicians in the network. You might want to find out how long it's going to take to get an appointment, but patients with Medicare and patients with Medicaid might not have that access, and that's important to allow those patients to have access to.
Doctors retiring.
Yes.
So everyone up here has said that this bill makes no sense. So the question is, did it make sense in 1996? When did it stop making sense? And what was the impetus to say, hey, this doesn't make sense, we got to change it? Did that happen last year? Did that happen 10 years ago? Give me a timeline of sensibility of this bill.
Mike.
So Tom, what happened in 1996 was a CMS regulation, and in order to change the regulation, we need new legislation. So 1996, believe it or not, is the base year for how Medicare reimburses hospitals today across all services. So the diagnostic-related group system, the DRG system that Medicare uses to pay us, is based on 1996 practice. Graduate medical education is a component of that system. And so what they did is they just froze it, right? Because they chose 1996. When the DRG system was first devised, by the way, New Jersey was the demonstration state where it was created, was never intended to be frozen for such a long period of time. The theory behind a DRG-based system is every 2 to 3 years, you rebase. You update for all the changes that are occurring in science and the society and how we deliver medicine. We have not done that. Escalation factors are only so good. So very much so, the flaw in the Medicare reimbursement system today, a big part of it, is it is still based in 1996 medicine. This legislation for GME will help change that.
Yes.
Yeah.
This question for the legislators. Where is the bill right now in the process? What stage is it at, and what kind of support have you gotten so far from the bill?
Well, we're just starting in the Senate, but I think we have a great opportunity. The way the bill is devised is not just to help Holy Name. It is broader based. The reason we specifically include rural elements is to appeal to a broader universe of our colleagues in the Senate and in the House and in underserved areas. We think that has a lot of appeal. In terms of process, the Senate Finance Committee, as does the Ways and Means Committee, has some of the primary jurisdiction over healthcare. So we're fortunate that Bill sits on the Ways and Means Committee. I sit on the Senate Finance Committee. We'll talk to our colleagues who have other committee issues and have interests. There's going to be, at some point in this session of Congress, which is the rest of this year and into next year, there is going to be a Medicare bill of some nature. There is going to be some omnibus bills on some nature. It is our hope to use this bill in that vehicle to make it happen. And we think that, as in everything in legislating, there's a negotiation to take place. I will look at some things I may not particularly have either an interest in or care about, but if the things I care about are sufficient, that I can accept the things I don't really care about or don't like, at the end of the day, we will get a negotiated bill. And so it's our hope that this is the process that we'll achieve a goal from. And we think that the appeal is universal. If we were doing a single rifle shot just for Holy Name, that would be very difficult. But this is broader because of the way that the bill is fashioned to attract a greater universe of college. I don't know if you want to talk about the House issues.
No, we're ready in the Ways and Means Committee. We have put Medicare, we've been talking about it a lot. We passed legislation, but you're going to have a lot of changes in Medicare because of the thresholds that go back 15, 20 years. We're in a different ballgame now. It's an entirely different situation. And we have to address those shortfalls in Medicare. And that's what we're doing in Social Security. Nobody wanted to touch it. It was a hot wire. We're going to bring it up in the next couple of weeks, in fact. And I think it's changing times, changing services, and changing policies. Next question.
Brenda?
Yes.
There was a similar bill that was introduced a year ago. What were the obstacles that will make this bill able to overcome the obstacles that apparently prevented that?
Well, it was introduced last year. We did get some support. It's time to move on, so we introduced it this year, starting with the new session in January. And we're going to work hard to get sponsors, and we're going to work hard to get folks to support it, because we're going to need them on votes to change anything. Because the closer we get to next year, the less we do. I mean, that's a matter of historical attention.
Sorry. Go ahead. Sometimes these fights take a couple Congresses, unfortunately. Even though the ones that make a lot of sense, you look at the Gateway Tunnel, how frustrating that is, right? That just makes sense, and we keep fighting it, and and there's bipartisan support for it. So, but I think there's real momentum building for this, as the senator said and the congressman said. This affects many hospitals in the country, and so I'm hopeful that this is going to get done. And obviously, having Congressman Pascrell in Ways and Means, and obviously Senator Menendez championing in the Senate makes a very big difference.
Let me add, Brenda, that In legislative processes, time and circumstances sometimes create an opportunity that does not exist before. You have a new majority in the House of Representatives since this bill was originally introduced. That creates an impetus where a majority decides what will or will not ultimately be brought before a committee on the floor, number one. Number two, we're going to have a Medicare bill. I have no question about it. The scope of that bill is yet to be determined, but that gives us a moving, what I call a moving vehicle, something that is likely to become law that you seek to attach something to. So maybe if we try to stand this up alone and get it passed, even though we think it has broad appeal, at the end of the day, when it is riding on something else that has to be voted on, it is more likely to happen. And so those two circumstances make it uniquely different than the last time.
Anything else?
Okay.
Thank you very much, everyone. Yes?
Senator, just quickly, your reaction to the president's tweet this weekend?
Which one?
Congresswoman of color going back to...
If I get back to the my job in time this afternoon, I intend to speak on the floor. I think this is a horrendous moment for the country. So I went back into all my notes over the 24 years dealing with immigration, and I've never seen a time when we have pointed our fingers at people because of their religion or because of their geography. We have 4 borders, not one. And I want to know if anybody, I'm an Italian American, I'm 100%, since you asked. I'm 100% Italian. I wonder if we went after any Italian, Italians all come here legally. Oh, really? Oh, really? This is not a movie, this is reality. That's all I got to say right now.
Look, the only thing I would say is the greatest experiment in the history of mankind is the United States of America, a nation that brought people from all corners of the globe, and through their hard work and sacrifice and ingenuity has created, in my view, the greatest country on the face of the earth. That's the great American experiment. It renews itself year after year, decade after decade, by new immigrants who come from across the world. The greatest startups in our nation have been started up by immigrants of different countries. And so the reality is that when the president uses that type of language, which is not only derogatory and discriminatory, but in my own personal view, bigoted, these members of Congress, several of them born in the United States, when did they become a second-class citizen of the United States? They did not. And those who are naturalized, they are full citizens of the United States. I have CEOs of this state who have told me about their parents' history. One of the CEOs of the largest companies in this state, his father was Italian, and he came here illegally. He jumped a boat that entered into New York Harbor, and from that boat entered into the United States. And he gave a son that runs one of the major companies in the state. That history is replicated time and time again. The President of the United States, whoever he or she would be, needs to be the great uniter, needs to rejoice in the contributions that people from different walks of life had made in this nation. And that is really the most harmful thing that I think comes from the President's tweet. So I hope there's a different future. Thank you all very much.
And how do you get the best students with the top grades in math and science to become doctors instead of making emojis or going into Wall Street or something like that? Right. I don't know that I've ever seen a PR program for physicians. Is that part of the issue?
Absolutely. And so part of this is by having an expanded slot. So part of what Holy Name will do is exactly create that PR element, but also back it up with real substantive practice. So by word of mouth, students will come here and realize that being a physician and caring for people in your community is one of the noblest professions you could ever have, and we'll make that reconnection. The reimbursement system, the economics of medicine over the last 3 decades has really criminalized that relationship and that the prestige that being a physician once had. And so we want to restore that and reestablish it and do it by experience, teaching, and innovation.
Yeah, but is there an active program, say, when you go to colleges, do you go, you or your colleagues, do you go to colleges, the biology departments, biochemistry, chemistry departments?
Right.
Do you go there and pitch, hey, medical school could be for you, you could make money, it's a good career, et cetera?
Today we don't, because Holy Name couldn't follow up on that promise, right? So part of this bill is to allow us to be able to follow up on that promise, and part of our partnership with Mount Sinai is that is exactly what we're going to do. And we're going to move, at least in the New York metropolitan area, of changing the perception and restoring the prestige and the dignity of being a physician that we once had.
And can you assure the public that the quality of medical care will not suffer as all of a sudden you have so many people at the same time?
Right, absolutely. In fact, what I would think it would happen is it would actually be enhanced. So this will be a well-supervised, well-structured academic program, and by having that, through that teaching process, we found this with our nursing school. When you have inquisitive students, the actual delivery of medicine gets better.